what digital technology has done is universalize these technologies. And now they enable us to leverage on this kind of technology so that you officers can onboard 6 million farmers onto a digital platform and enable us to deliver that fertilizer subsidy at the touch of a button. So he said, even in health, what enables us to now be able to universalize our healthcare system is to use leverage on that digital technology. Because digital technology does not discriminate whether you are informal, whether you are a pastoralist, whether you are, it doesn't discriminate. You are now able to connect the connectivity with every Kenyan. You do not need to be in a formal institution for us to be able to plan and whatever. And we've already started in the healthcare. I think many of you will have interacted with the community health promoters. We have built that digital platform. It is now possible for this doctor sitting here to tell you today how many people have been visited by CHPs. They have taken their blood pressure and their blood sugar, and how many people have been referred for further investigation, potentially for diabetes or high blood pressure or hypertension. Now, that capability means that person, that old person who has, that parent or whoever, who has been investigated and for diabetes, that is probably a kidney disease averted. That person who has been investigated and referred for hypertension, it is heart disease averted. It's a heart disease averted. So with that capability then enable us to bring the quality of health care, world-class quality of health care to that person. In fact, probably better than many other places, including developed countries in the world. It allows us to begin to close that gap. So that is the opportunity, and not only opportunity, but imperative. Why this is so important? It is so important because in terms of healthcare cost, if you can avert that case of that person, and now we are moving to a case where society is also aging, so that you are shifting towards moving from a burden of infectious diseases to what these people here call non-communicable diseases. And once you move to non-communicable diseases, the kidney, the heart, the kidneys, all those cancers, the burden of catastrophic expenditures become even heavier. Very heavier. So it is very important that we take this action now. And we put everybody in one pool, one insured system, one provision system, because that burden, when that burden happens and that person needs to go to India and they need 5 million shillings, all of us have to put that money. And that money is we are taking out of other economic activity. The disease burden and the financial cost of that disease burden might actually overwhelm us economically. So we are not going to make economic progress until we solve our healthcare financing problem, healthcare financing challenge. That is the message. So people are going to ask lots of questions. Why do we have to pay more for this social health insurance, where we can get social health insurance, private health insurance somewhere else? That is the problem we have had in this country, where we have a small group of people who are able to provide for themselves in that enclave that I talked about of a small privileged economy. You think you have left everybody else behind. You think it is not your problem. But in fact, what it does is that it drags all of us down. It is keeping us down, because you cannot leave behind 55 million people. You cannot have a prosperous economy. You cannot transform this economy and society by having only 2 million or 3 million people in the formal economy, with institutions designed around those people living behind. the other 55 million Kenyans. I think that's the message that I hope we can be able to convey to everyone, so that we understand that we cannot leave anyone behind. It is counterproductive, it is defeatist. That is why we look developed, but we are not developed. So thank you very much for listening to me.